For hundreds of years, newborns who appeared healthy at birth later had severe intellectual or physical disability, or died because their genetic and heritable disorders went undetected and untreated. The initial work of Dr. Robert Guthrie and all the work that has followed has helped save hundreds of thousands of babies and children from the effects of such disorders. Thanks to advancing science and technology, newborns can now be screened for an ever-increasing number of diseases, all from the same dried blood spot specimen. The list of diseases that can now be detected by newborn dried blood spot screening is extensive. It includes amino acid diseases such as PKU, fatty acid oxidation disorders such as MCAD, organic acid disorders such as propionic acidemia, other inborn errors of metabolism, such as galactosemia and biotinidase deficiency, and G6PD deficiency. Endocrine diseases, such as congenital hypothyroidism and congenital adrenal hyperplasia. Hemoglobin diseases, such as sickle cell diseases, including sickle cell anemia and some thalassemias. And pulmonary diseases, such as cystic fibrosis. Screening for immune diseases such as severe combined immunodeficiency or SCID has been added by some screening programs, as well as lysosomal diseases. Other screened diseases include adrenoleukodystrophy and spinal muscular atrophy. Your role in newborn screening is key to preventing these and other devastating disorders from destroying young lives. Yes, you can make a difference. Every time you collect a few drops of a newborn's blood on the filter paper portion of a specimen collection device for newborn screening, you're making a difference in the quality of life for that child and his or her family. That's because your actions, which are critical to accurate newborn screening results, make it possible to detect and treat a variety of debilitating and life-threatening disorders before it is too late.
The goal of newborn screening is to identify and treat newborns with life-threatening and life-impairing disorders before symptoms appear and they become critically ill. With newborn screening, we identify disorders that, when treated late or left untreated, can lead to severe physical and intellectual disabilities and even death. Correctly identifying the newborn and collecting the blood specimens properly on the right newborn screening collection device and in a timely manner are critical to ensuring accurate test results. Of equal importance is the correct recording of patient information, essential for ensuring that newborns with unsatisfactory or out-of-range results can be recalled quickly for subsequent tests.
Because newborn screening is the key to preventing disability and death for thousands of newborns every year, your role in screening is vital. This video will show you the most up-to-date instructions on how to perform that role correctly. In this video, you'll see exactly how to prepare for specimen collection, collect blood spots using the recommended heel stick technique with application directly onto the specimen collection device, allow blood spots to dry without touching other surfaces and remaining horizontally level for at least 3 hours away from direct sunlight or heat, handle specimens properly, maintain appropriate records, and transfer specimens to the screening laboratory in a timely manner, and prevent testing problems that can delay the newborn's diagnosis and treatment. For current details on these and related topics, consult the most current edition of CLSI Standard NBS01, Dried Blood Spot Specimen Collection for Newborn Screening. Now let's see how you can make a difference through careful, accurate screening, beginning with preparation. Check local or regional regulations or guidelines regarding the appropriate age of the newborn for specimen collection. Specimen collection timing is important because concentrations of some metabolites and hormones increase or decrease as newborns get older. Factors affecting specimen collection timing need to be documented with demographic and other information. To prepare for specimen collection, you need to gather the appropriate supplies, complete the patient's information accurately and completely, and prepare yourself and the newborn. When gathering supplies, first select a sterile disposable lancet. Permanently retractable puncture devices are commercially available in many locations and have safety advantages for both the collector and the newborn. For the newborn, single-use devices ensure that no diseases are transmitted, and the retractable feature ensures that the lancet does not go too deep. Although many different types of lancets are available, choose one that makes a puncture with an incision depth that's 2 millimeters or less for average weight-term newborns. This puncture depth is critical for newborns, especially small premature ones. If the newborn you're screening weighs 1,700 grams, about 3 pounds 12 ounces or less, use a lancet that makes a puncture with a shorter incision depth. Next, obtain a sterile alcohol swab or follow institutional policy, making sure that the alcohol is 70% isopropanol. Avoid using other antibacterial or disinfectant products unless approved by the screening laboratory because they may adversely affect the test results. Then be sure to obtain several individually wrapped dry and clean or sterile gauze pads, an approved heel-warming device, or a soft cloth diaper as an alternative, and powder-free gloves. Follow standard precautions practices, use powder-free gloves, and follow local recommendations for use of latex gloves in situations of latex allergy. Also, make sure you have clearly marked containers for the disposal of biohazardous materials and sharp items. The containers should be puncture-proof with lids. Before filling out the patient information, make sure that the writing surface is clean and dry. This step is designed to prevent water, alcohol, formula, hand lotion, and powder from contaminating the specimen and affecting test results. Next, obtain your program's official newborn screening specimen collection device. If some patient information is already recorded, check to see that it matches other patient identifying information and the newborn's ID bracelet. The filter paper portion of the device is a highly specialized grade or matrix designed for blood collection. In the United States, the manufacturer of blood collection devices must comply with the U.S. Food and Drug Administration's regulations. Otherwise, adhere to local regulations. Be sure to check that the newborn screening specimen collection device expiration date has not already passed. If the collection device has expired, replace this device with one that has not exceeded the expiration date. Now, properly complete the demographic and other information in the demographic section of the specimen collection device. Print legibly with a ballpoint pen. Do not use a typewriter or other mechanical printing device because it may compress and contaminate the paper. Remember that this step is critical. Accurate and legible patient information is essential for accurate interpretation of the screening test results and for rapid newborn screening follow-up. Contacting the newborn's health professional and parents to recall at-risk newborns for additional testing is essential. If you record the information inaccurately, incompletely, or illegibly, locating the newborn may be delayed. This, in turn, may delay diagnosis and treatment of a disorder with tragic consequences for the newborn. Refer to the most current edition of CLSI document NBS02, Newborn Screening Follow-Up. While demographic and other information is often entered manually, it may be acceptable to use electronic forms or pre-printed labels as long as all requested patient information is included and there is adequate verification that the information matches the patient. Pre-printed labels should be attached to each page if the device has multiple pages. Be sure to include information on labels as instructed in NBS01. Most newborn screening specimen collection devices are now made with a protective fold-over cover. This cover protects the specimen against contamination. Also, this cover is in compliance with U.S. and other countries' mail requirements in that the fold-over cover constitutes the inner cover of the required double container. The biohazard label, which is also required inside of the mailing container, is usually affixed to or printed on the outer fold of the fold-over flap. Even with gloves, never touch the filter paper in the area around or within the pre-printed circles in order to avoid contamination of the specimen. Now you're ready to prepare yourself and the newborn for blood collection. Because newborn screening uses blood for testing, remember to follow standard blood handling precautions to reduce your risk of infection. For more information on these precautions, see the most current edition of CLSI document M29. To prepare the newborn, first select the puncture site. Choose a site on the most medial, inner, or lateral outer sections of the plantar or walking surface of the foot. These are the preferred and safest areas for puncture because the heel bone is not close to the skin surface in these areas. Do not select a puncture site in a finger, toe, or the posterior curvature of the heel because of the risk of damage to the bone. Also avoid choosing a site in the arch of the foot, a previous puncture site, an edematous or swollen area, or the earlobe. For more information, please refer to the most current edition of NBS01, Dried Blood Spot Specimen Collection for Newborn Screening. Next, wash your hands vigorously and put on your powder-free gloves. Again, confirm that the information on the newborn's identification band matches the information on the newborn screening specimen collection device. Remember, it's your responsibility to make sure that you place the specimen on the collection device and it matches to the correct newborn. It is also your responsibility to make sure the newborn stays warm. So wrap the newborn in a blanket and expose only the puncture site as needed. If approved by your institution's policy, increase blood flow to the puncture site by warming the newborn's heel. To do this, use an approved heel warming device. Or, as an alternative, apply a soft, warm, moist towel or diaper on the site for 3 minutes. Make sure that the temperature of the water is no more than 42 degrees Celsius. A higher temperature could burn the newborn's delicate skin. Next, position the newborn's leg lower than the heart. This increases venous pressure and enhances blood flow to the heel. Then, wipe the puncture site with a sterile alcohol swab or following institutional policy. Let the skin air dry completely, allowing optimal decontamination and reducing the potential for residual alcohol to dilute the specimen and affect test results or cause hemolysis. Hemolysis is the breakdown of red blood cells, which can create serum rings and make the specimen unusable. Some non-pharmacological methods have proven successful in reducing pain in newborns, such as gently massaging the leg before performing a heel stick, non-nutritive sucking by the newborn during the heel stick procedure. Other methods that have also been known to soothe the newborn either before or during specimen collection include breastfeeding during the heel stick procedure, giving an oral glucose or sucrose solution of 20% to 30% 2 minutes before the heel stick procedure, swaddling the baby in an upright position during the heel stick procedure. Now you're ready to puncture the skin and collect the blood specimen. Unless otherwise directed by instructions on the Lancet package, puncture the newborn's heel using one continuous motion, or activate the spring-loaded puncture device according to the manufacturer's instructions. Gently wipe off the first drop of blood with a dry and clean or sterile gauze pad. Don't apply the first drop of blood to the collection device. Let a second large drop of blood form. To enhance this process, gently apply and release pressure around the heel, but don't squeeze or milk the puncture site. These actions can cause hemolysis or contaminate the specimen with tissue fluids. Now gently touch the filter paper to the large drop of blood. Do not press the paper against the puncture site or heel. Let the blood soak through and completely fill the pre-printed circle. Apply blood to only one side of the filter paper section of the collection device while checking to see that blood is thoroughly saturating to the other side. Before filling the next pre-printed circle, check that both sides of the circle on the filter paper section of the collection device are sufficiently saturated. Gentle leg massaging toward the heel may enhance blood flow. For each pre-printed circle, keep the filter paper section of the collection device against the blood drop until you see the blood soak through and thoroughly saturate the paper. Do not allow the filter paper to touch the heel skin or puncture site. Be patient. This process takes more time in some newborns than in others. Always make sure the blood drop is large enough to completely fill a circle in one step. Do not apply successive blood drops to the same circle, even if the circle is not completely filled, because this can cause caking, layering, and non-uniform concentrations of blood. Continue to correctly fill all circles on the specimen collection device in the same way. If the newborn has reduced blood flow and you are unable to fill the circles, repeat the procedure using a different puncture site and another sterile lancet, alcohol swab, and sterile gauze pads, according to institutional policy. Always begin with an empty pre-printed circle and continue to fill the remaining circles on the same specimen collection device. When you have filled the required number of circles and assured the quality of the specimen, care for the newborn's puncture site. First, elevate the foot above the body. Then press a clean or sterile gauze pad against the site until the bleeding stops. Do not apply any bandage with adhesive to the puncture site because it could damage the newborn's fragile skin. Dispose of the used lancet in the appropriate sharps container and place any other contaminated supplies in the proper biohazard container. Remove and dispose of your gloves and wash your hands. If you need to collect a blood specimen from another newborn, put on a new pair of gloves. Collecting a heel stick blood specimen directly onto the filter paper is the method of choice. At times, you may need to consider alternative methods of collection. Refer to subchapters 5.3 to 5.5 of the current edition of NBS01 for other collection methods, if allowed by local regulations, accreditation criteria, and your institution's policy. Proper specimen handling technique is critical to ensure accurate test results. When using a specimen collection device with a protective flap, it is important not to fold the flap over the wet blood spots until they have thoroughly dried. After filling all the circles, let the specimens air dry at room temperature, about 18 to 25 degrees Celsius, for at least 3 hours. If the relative humidity is above 50%, it may cause longer drying times. Avoid temperature extremes during drying. Be sure to suspend the specimen collection device horizontally during drying. Drying it vertically may result in blood flowing to one side of the circle, which would result in non-uniform analyte concentrations throughout the dried blood spot specimen circle. Ensure that the protective flap does not touch or cover the blood spots until they are completely dry. When drying blood spots, do not expose them to excessive heat or direct sunlight. Store them in plastic bags without desiccation. Stack them so that circles from adjacent devices can come into contact with them, or let them touch other surfaces. Inadequate or incorrect drying will cause damage to the specimen. Once the specimen is completely dry, close the protective flap and place it in a suitable envelope or other approved container for transport to the laboratory. When more than one specimen is transported, never allow the dried blood spots to touch other dried blood spots. If the blood collection device does not have a protective cover, then rotate the specimens 180 degrees so the dried blood spots on the adjacent specimens do not touch. Check with your newborn screening program for additional mailing or shipping requirements, or see the shipping guidelines for dried blood spot specimens on the Centers for Disease Control and Prevention website. During collection and drying, take care to avoid exposing the specimens to humidity or extreme heat. Using a courier service during transport may reduce the risk of exposing specimens to humidity and heat. Climatic extremes can adversely affect the specimen's stability and analysis. In extremely hot and humid locations, consider refrigerated transport by courier. Unless your screening program requires different procedures, send the thoroughly dried newborn screening specimens to the screening laboratory as soon as possible, and preferably within 24 hours of collection. Never wait to send 3 or 4 days' worth of specimens to the screening laboratory, because this delays testing and can put the baby's life in danger. If you must mail the specimens, make sure there is a pickup scheduled within a few hours of when the specimens are ready. If you use a courier service, be aware of when the scheduled daily courier pickup is. If you don't have a daily pickup service, be sure to schedule a pickup and specify a time soon after the specimen is dry. Keep accurate records of when and how specimens were sent. When using a courier, the courier should be instructed to document pickup and delivery of all specimens in his or her care. Remember that timing is critical. Delays in delivering baby specimens to the screening laboratory for testing can delay the diagnosis and treatment of an affected newborn, which could be disastrous. Keep records of when results were received and any follow-up actions taken. Make sure that you or your institution receives all newborn screening test results from the screening laboratory in a timely manner. If any results are missing, contact the screening laboratory immediately. If follow-up is needed, assist the newborn screening follow-up program in any way possible. Ideally, institutions should have a mechanism to ensure that all results have been received and that babies needing follow-up care have been located and cared for. Find out if the screening laboratory received the specimen in question, and if so, ask for the test results. If the laboratory requests a repeat specimen from that newborn, obtain it as soon as possible, unless the laboratory directs otherwise. Consult your local or regional newborn screening program for guidance on what to do about follow-up of unsatisfactory specimens and positive or out-of-range results, or refer to the most current edition of CLSI document NBS02, Newborn Screening Follow-up, for additional information on recommended follow-up activities. Besides collecting and handling specimens properly, here are other activities you can do to ensure the success of newborn screening. First, keep accurate records. Appropriate tracking documentation is recommended and should be maintained for all specimen transit stages, from collection to testing laboratory delivery to result receipt. This practice helps ensure that every newborn is screened and that the laboratory's test results are received in a timely manner. It is important to record when the specimen is collected, when it is sent to the screening laboratory, and when results are returned. Timeliness of these steps is critical to the process of newborn screening. Also, in each newborn's medical record, document the screening test results and follow-up actions taken according to your newborn screening program's guidelines. Second, store the newborn screening specimen collection devices properly by stacking them in the same manner as they were in the original packaging when shipped. The filter paper section of the collection device is made from 100% cotton linters, is additive-free, and has been tested extensively to ensure consistent and reproducible results. Proper storage of the specimen collection device prevents filter paper compression, which may alter its performance. Preventing compression is important because the filter paper is specially manufactured to ensure consistent blood absorption. When properly stored, newborn screening specimen collection devices are stable for up to 5 years. Always check the expiration date printed on the specimen collection device before using. Third, prevent collection problems which can lead to poor quality and unacceptable specimens. Refer to the most current edition of NBS01, Dried Blood Spot Specimen Collection for Newborn Screening. Unacceptable specimens, either poor quality or insufficient quantity, place an unnecessary burden on the screening facility, cause unnecessary trauma to the newborn and their family, and delay detection and treatment. Here are a few common problems and ways to avoid them. One problem is alcohol contamination of the specimen. Water or other contaminants may also cause interference during analysis. To prevent it, let the alcohol air dry completely before puncturing the skin. Collecting too little blood can cause a problem too. To avoid this problem, move the filter paper section of the collection device away from the blood drop when the blood has soaked through completely. Check both sides of the filter paper to be certain that the specimen is adequate. Conversely, using too much blood can create a different problem. Do not apply excessive amounts of blood to a pre-printed circle. Depending on local rules and regulations, overfilling the pre-printed circle may result in an unacceptable DBS specimen. To avoid this problem, don't oversaturate or apply blood to both sides of the filter paper. Drying the specimen in contact with a solid surface can cause problems. To avoid this problem, dry the specimen completely before folding the protective flap over the blood collection section. In this video, you've seen how to collect the blood specimen correctly to maximize the effectiveness of newborn screening. To summarize, you learned how to fill out the newborn screening demographic and other information on the specimen collection device form accurately, legibly, and completely on a clean, dry surface. Verify that the newborn to be screened and the patient information match. Select the safest area for puncturing the newborn skin. Wipe the newborn's heel with 70% isopropanol or per your institution's policy and allow it to air dry. Puncture the skin with a sterile lancet while wearing gloves. Gently wipe off the first blood drop with a clean or sterile gauze pad. Apply light pressure and release it until a second large drop of blood forms. Touch the printed side of the blood collection device to the blood drop without touching the skin. Carefully fill each pre-printed circle with a single application of blood to collect an acceptable specimen. Let the specimen air dry thoroughly in a horizontal position. Place the newborn screening specimen collection device containing dried blood with closed fold-over flap in a mailing or shipping envelope and send it as soon as possible, preferably within 24 hours of collection, to the screening laboratory. Keep records of specimens sent, test results received, and completed follow-up actions if applicable.
Our children deserve the best start in life. We give our newborns the best chance at early and successful treatment by completing all of the required information, obtaining satisfactory blood spots on the newborn screening specimen collection devices, and ensuring that the specimens reach the laboratory as soon as possible. Every person involved in newborn screening is critical to successfully identifying affected newborns and preventing the effects of genetic and heritable disorders. The clinician's importance in newborn screening will likely grow because tests are now available and continue to be developed that screen for additional genetic disorders, all from a single blood spot specimen.
As you've seen, accurate screening begins with you. By performing these steps carefully and accurately, you can make a difference by allowing children to lead normal lives and, in many cases, saving their lives. Although this video has presented the basics of blood collection on a specimen collection device for newborn screening, you should read the most current edition of CLSI document NBS01 in its entirety. This video and the standard go hand in hand. This program was produced by CLSI, a not-for-profit membership organization that brings together the varied perspectives and expertise of the worldwide laboratory community to foster excellence in laboratory medicine. For additional information, visit the CLSI website at clsi.org or call 610-688-0100.
All these diseases and disorders, so rare that they test for, never thought that my child would ever have something like that. His life would have been completely different had I not taken that test, not had the diagnosis so early on. So we feel very blessed.
6-year-old Emerson is healthy, but when Everett was 5 days old, his parents learned that his newborn screening test indicated a rare condition called galactosemia.
There's no other galactosemia or metabolic disorders in our family whatsoever, so that wasn't even on my radar.
Babies with galactosemia like Everett are unable to digest milk properly, so a byproduct called galactose 1-phosphate builds up in their bodies like a poison. Without newborn screening, the Olsons might not have known Everett was in danger in time to save him.
This is a disorder that if it's even in a few days later, could have had such horrible ramifications on Everett. Other kids that haven't have gone into comas and have had severe liver damage. We just have to adjust his diet.
And then we stand back because it's hot.
It's not that hard. There's wonderful, delicious things that are safe for him.
Bye, cake.
It happened so incredibly fast. He became lethargic. I couldn't wake him up. He looked yellow.
Based on the results of Everett Olson's newborn screen, His doctor knew the milk he'd digested during his first few days of life could be causing his problems. He was rushed to the hospital.
If we didn't have a diagnosis, they'd probably want to feed him more milk, because when you're jaundiced, you want to get those liquids in.
Want some milk in your cereal? Some rice milk?
There's rice milks, there's almond milks, coconut milk is okay. Now we've gotten used to it, he's gotten used to it. Sometimes we don't even think about it. But it would have been very different had we not had that diagnosis. 75% infant mortality rate, he might have not been with us. You know, Everett's doing really well. And a lot of people are very surprised when I tell them that he has a pretty serious rare genetic disorder. But it was caught through newborn screening. So we're very passionate about getting the message out how it can save a life. It helped our son. It saved our son's life. I'm thankful for that blood spot.